We will now look at pregnancy and fetal nutrition. So lots of things actually change during pregnancy, and things such as the energy needs are going to change. Pregnancy increases maternal energy requirements, and it really depends on the trimester that someone is in as how much additional energy needs that they actually require. This is based on the growth of the fetus and the placenta, the expansion of maternal tissues. There's also an increased size of the mother, so her basal metabolic rate increases, so the energy demands go up, especially if she starts doing physical activity. The estimated energy requirement is approximately about 10%, and that works out at 1,040 additional kilojoules per day. If we look at some of the nutritional changes, there's basically a lot of major remodeling that's going on. There's new tissue that's being formed. So the uterus, remember I mentioned it enlarges 1,000 times. You've got the formation of the placenta. There's an increased needs for obviously energy, protein, lipids, and especially if the baby's not growing at the right sort of growth rate, then there might be even additional needs. But the micronutrients that really increase are things such as iron, calcium. The needs don't actually increase in terms of the pregnancy RDIs because the absorption rate gets better. But we need to make sure that the mother, the expectant mother, is having a calcium-rich diet. So that could be from a variety of sources. We also need to make sure there's plenty of vitamin D coming in, folate, which we mentioned in the previous lecture, and iodine as well, because iodine has been linked with obviously the thyroid function, but neurological development with low levels of iodine, which is why they introduced fortification in Australia to offset these low iodine levels because it influences the neurological function. So the energy demands increase, so that it goes up. Let me see if I'll find that slide for us. It goes up, as I was mentioning, about 1,040. It goes for the first trimester. There's usually no additional increase in energy intake. When we get to second trimester, it goes up to 1,000 and 1,400 kilojoules additional per day. When we're in the third trimester, it's 1,900 kilojoules per day. That's additional. Lactation goes up to 2,210 kilojoules per day. So there is, as you can see, quite a substantial increase there, especially when we get into the third and final trimester and into lactation as well. In terms of protein, the protein rate at which protein deposit increases as pregnancy progresses. So in terms of the average protein increase, we talk about going up to sort of up to that sort of 1 gram per kilogram of body weight per day. The protein turnover is important for formation of enzymes, for collagen, for muscles, and the hormones are going to signal the body that you're in a state of this anabolism, so anabolism breaking down, and that's going to help to try and retain nitrogen for protein synthesis. So major requirements of protein in pregnancy, and so we need to make sure that we're having good sources there, etc. When we get to things such as just got there for protein, that's your protein requirements in pregnancy, and as opposed to just the standard RDIs. In terms of lipids, these are really important for neurological developments, and it helps with the transfer of long-chain PUFAs, so polyunsaturated fatty acids, from the mother to fetus, and this is closely correlated with what the mother actually ingests. And the concentrations are predictive of, we talk about eicosapentaenoic acid, so EPA and DHA, and this is also being linked back to the concentration which is in the umbilical cord. Adequate We need to maintain adequate supply, so intake is important, so maternal intake, and that's going to therefore influence what the baby's levels are. It's important for cell integrity, cell membranes, brain, eye function, especially when we get into the later pregnancy. We're looking at the DHA levels, the DPA levels. This has been linked with terms of that baby's brain development and their retina development. So, as I said, the fatty acid stores of the infant has a high correlation with the stores of the mother. So the best sources, as we know, are things such as your oily fish. However, we want to decrease the amount of methyl mercury, especially in pregnancy, so we want to probably avoid things such as bigger fish, such as tuna, and go for smaller fishes like sardine, salmon, etc. If you have a patient who is a vegan, you could get something like argan oil, which has been shown to have high levels and the correct ratio of EPA to DHA. Things such as, flaxseed and chia seed do have some omega-3s, but it's a very poor conversion, and you have to eat a lot more of it to actually able to get that amount in. Data shows also things such as your fibre and water requirements. Fibre is very important to maintain that motility in the bowel. We've mentioned already that the bowel can become quite sluggish, so having that additional water is important. Here's some of your the B group vitamins, so your water-soluble vitamins here. And it can be sort of slight increase, especially when we get to your B9, your folic acid. So we want foods that are rich in folic acid or folate. We eat folate and we can take folic acid. So it's really important pre-conception and the first trimester of the pregnancy. So it's a time of rapid growth, cell division, and having low levels, that B9, that folate, has been associated with adverse outcomes such as we talked about neurotube before, spina bifida, also raised levels of blood homocysteine, and has been linked with preeclampsia. And it also helps to prevent megaloblastic anemia, so much larger cells, etc. When we get to something like a B6, this may help mitigate nausea and vomiting. It's not generally associated with adverse birth outcomes, but they, had talked about 25 milligrams every night. So there's some really good studies on that as well. B12 is another one. It can cause elevated homocysteine, or lack of B12 can cause elevated homocysteine. It's recommended for both requirement for the fetus and extra metabolic demands of the mother. Look, the only natural source is animal products. So, these work, folate and B12 work together to prevent preeclampsia and that risk of neural tube syndrome. So, we do need to make sure we have adequate levels of both. Fat-soluble vitamins. Your vitamin A. Now, we have mentioned in the past when we looked at vitamin A, it has been linked with birth defects. However, the evidence is showing that younger adults tend to have a lower intake. So remember that excess levels can be quite dangerous, could even cause birth defects. It is required for the fetus and the maternal tissue growth, and intakes increase to account for the maternal storage. So, try not to eat liver or too much liver products, etc. And we did discuss that when we talked about vitamin A, but avoiding that. The other one I want to focus on for a sec is vitamin D, and there's some really interesting research to show that vitamin D levels, and especially in Australia, have been low in expectant mothers. So if we touched on this a little bit when we were talking about vitamin D, if the vitamin D levels are low in the mother, then the offspring are much more likely to have issues with bone health and laying down those bone minerals. And it has been also linked with rickets, which we hadn't seen rickets since the early 1900s. So it is important that mothers are getting enough in their diet, but also some time in the sun to enhance that vitamin D absorption. So remember, it's through that synthesis of the skin. So there has been like recently more cases of vitamin D deficiency, of cases where refugees are coming into Australia and had low levels of vitamin D from where they're coming from, and maybe not getting enough in their diet and not getting exposure to the sun, etc. Vitamin K, we touched on that a little bit when we talked about blood clotting, and vitamin D is also important in terms of its high level of antioxidant as well. Some of the other ones there. Now, calcium needs do not increase. There's no additional allowance for pregnancy. So the gastrointestinal tract is more effective in the uptake. So it has this physiological adaptation. We have this improved absorption. And again, we're assuming that someone is getting this. Okay, so we're assuming that there's the usual dietary intake is adequate. Are people having 3 serves of calcium-rich foods in a day? If they weren't, then that's something you really need to be looking at, to making sure that they are having enough. And so, look, babies born at full term have around 20 to 30 grams of calcium, and this is really laid down in that 3rd trimester. But sometimes, especially with adolescents, we've found in general that they may not be getting enough calcium, so they actually may need some more. The other one there I want to talk about is iodine. I mentioned it briefly, but it's very important for our thyroid hormones, T3, T4. And so it's high in pregnancy due to the increase in production of thyroid hormones, so it's requiring iodine. The greatest risk is to the developing fetus, and it's also linked with neurological development. Iron, this is a big one, hasn't it? Look, it's gone up to 27 milligrams per day, and that's it's the highest requirement in pregnancy. In the 2nd and 3rd trimesters especially, it's up to that 27 milligrams. It's the highest stage in any of the lifespans, and this can be really difficult to achieve in the diet, especially if you've got someone who's got low levels to start with. You're going to find it's really difficult to get it up. The increased needs help to build the iron stores, and that's required for the fetus and the placenta. And the production of those red blood cells and blood loss can be, that's later in this, going into the labour, etc. As I said, difficult to achieve in the diet. If the levels are low, then the healthcare worker, the physician, will usually recommend iron supplementation, and that it's in itself can cause some problems, because a lot of people find that iron supplements may cause some gastric upset or maybe constipation, etc. as well. So poor maternal iron status, this is a risk obviously for anemia, childbirth complications, low birth weight babies, and also neonatal death as well. In terms of zinc, that's increased needs due to the maternal and the fetal tissue. The greatest need is in late pregnancy, and absorption from animal foods are much higher than plant foods. And it's been estimated from the evidence that around 82% of women in the world may have inadequate intakes of dietary zinc. So this is a really good one to be thinking about in pregnancy, because often women are not getting enough in their food. So they're sort of the major minerals that we need to look at. And this is just a bit of a summary of them there. Interesting, magnesium as well requires a fetus an average of 8 milligrams per day over 40 weeks. So again, we could be getting that through the diet. I've mentioned zinc already is important for tissue growth, cell replication, bone formation, skin integrity. It's also important for that protein synthesis, so synthesis and catabolism of our nucleic acids. So in the last trimester, it jumps up to 14 milligrams per day. And as I mentioned already, this is the greatest time we need iron, is in that 2nd and 3rd trimester. So it does go up to that 27 milligrams per day. So one of the things that we talk about often is a multivitamin or multi-nutrient supplement, especially something with folic acid, prior to falling pregnant, if possible. This could be a problem for lots of people because it's sort of unplanned pregnancies. So this is why we look at some products have been fortified with folic acid. A lot of our bakery products have folic acid, etc., enhanced or added to them. This is also going to help, to up those levels because maybe they're not on supplementation. And ideally, supplements should be commenced at least a couple of months prior to conception. But look, if it's just 1 month before, that's great, and then even into that first trimester, because it can really help to reduce the risk of neural tube syndrome, cleft palate, spina bifida, a whole range of things, limb defects, neuroblastoma.